Hi, I'm Dr. Catherine Sotir. I am Associate Professor of Family Medicine. I'm the Director for Predoctoral Education. I am originally from Boston, Massachusetts. After college, I did a cross-country trip with my wife and ended up in Santa Fe, New Mexico. I bartended and waited tables and was blown away by New Mexico. I actually had my favorite job there too, as a wrangler, just taking people through the mountains on horseback, like through these unbelievable sunsets. And after 4 years there, I decided to apply to medical school. So I bring to this program now 14 years of experience in full-time academics, both at community-based residency programs and university-based programs, as well as 9 years of private practice experience. I've been together with my wife for 38 years now, and I feel like the luckiest person on earth to get to live my life with her. I'm also a mom. I have 2 daughters, ages 14 and 16, and even at this age, they're honestly an absolute joy to be around and an inspiration to me. Okay, so my interests, background. So during my time in high volume private practice, I became fascinated with and started to develop an interest in healing and what makes patients or people heal. And then my time in medical school at University of New Mexico with a full problem-based learning curriculum, so I had no lectures my first 2 years, sparked my love of teaching and had a profound impact on the way that I view teaching and learning. So now fast forward to today, and my interests are still teaching and how to optimally teach and prepare residents and the medical students that rotate here, as well as healing and learning how, despite the stress around us in our world and our job, that we can heal ourselves and our patients. Okay, so my interests outside of medicine are hanging out with my family, just someone's on the piano. I'm trying really hard to learn guitar. It's amazing how bad I am, and I try really hard, but I love cooking, vegetarian cooking especially. I think all the residents know that I love running on the beach at sunrise. If someone's on call and they're about to check out in the morning, I'll send them a picture of the sunrise just to get them excited. Also love hanging out at the beach for moonrise, and I'm also into gardening. Okay, so let's talk about healing and how my interest of healing and how it's reflected in this program. One is through resident wellness. I was able to help create a curriculum with time set aside for residents to connect and rejuvenate and learn how to best care for themselves. And another aspect is through advocacy. I work with residents a bit as part of their overall health equity program, and how this relates to healing is that physicians often feel powerless working within a system that has multiple barriers set up for patients toward their health. And we start with the basics of looking at racism or criminal justice, often viewed as societal or political issues, and actually looking at these as really being medical issues. And actually you can check out the AAFP policies regarding these health equity issues. But in doing so, trying to get us to help reconnect with why we became physicians, and not only to help heal patients, but to help heal ourselves. Another aspect of that is that third-year residents can opt to design a 4-week elective to address their own specific learning needs. And most recently I've had residents focus on nutrition, or experiencing some complementary medicine themselves, or diving deeper into mindfulness. I've also recently just started a curriculum with the residents. It's technically called Mindful Minutes, but the real name is Mindless Minutes. And we just take 15 minutes and try to connect again with just being. So that's how my interest in healing is reflected in this program. My other interest of teaching in patient care, especially with second or third years, I push the residents not only to correctly diagnose a problem, but also to communicate with the patients in a way that empowers the patient and helps them to heal. I would absolutely love to get the opportunity to meet you. I can tell you this program, the thing that the residents have in common that really stands out to me is that they are kind. We do not have any jerks in this program, and we try to keep it that way. They're very encouraging of each other and also very nurturing of each other. So I love being in that kind of an environment, and hope I get to see you.